Every day we make choices about the foods we consume, often without fully considering their impact on our health. However, even a seemingly minor detail, such as a daily fruit snack, can be a powerful tool in combating a serious threat, the formation of dangerous blood clots. In this article, we will embark on an insightful journey through the world of foods that can offer invaluable support to our cardiovascular system and overall well-being. Blood clots, these gelatinous masses of blood, serve a vital function in our bodies, forming to stop bleeding and facilitate wound healing. Despite their protective role, in certain situations they can become life-threatening adversaries. Uncontrolled clot formation can lead to tragic events such as heart attacks, strokes, and pulmonary embolism. Therefore, to maintain health and prevent these conditions, it is crucial not only to understand the nature of this issue, but also to know effective methods for its prevention and management. In this article, we will delve into how a daily diet, particularly the regular consumption of certain fruits, can actively influence the regulation of clot formation in the body. Numerous scientific investigations and clinical studies clearly demonstrate that certain fruits possess exceptional properties, not only effectively preventing clot formation, but also, in some cases, aiding their dissolution. Readers will gain comprehensive insights not only into the nutritional value and benefits of these natural gifts, but also into the mechanisms by which their active components interact with the body's natural physiological processes, collectively contributing to improved vascular system health. Furthermore, incorporating these remarkable fruits into your diet is not only a scientifically supported, but also an incredibly enjoyable and delicious way to maintain vital heart health. This information will be beneficial for those already leading a healthy lifestyle and seeking to expand their knowledge, as well as for those just beginning their journey toward well-being and wishing to make small, yet potentially life-saving changes to their diet. Blood clots are complex gel-like formations that occur in the bloodstream. They are composed of platelets, microscopic blood cells crucial for clotting, and fibrin, a protein that forms the clot's mesh-like framework. The primary and vital function of clots is to stop bleeding when blood vessels are damaged, an essential part of the body's recovery process. However, despite this crucial function, clots can pose a serious health threat if they form in major arteries or veins without a visible cause, such as an injury. Even greater danger arises when a clot detaches from its formation site and begins circulating through the bloodstream. In such scenarios, severe and life-threatening conditions can develop, including deep vein thrombosis, DVT, where a clot blocks a major vein, most commonly in the leg. If a portion of the clot breaks off and travels to the lungs, it causes a pulmonary embolism, leading to blocked blood flow. In arteries, clots can cause a myocardial infarction, just heart attack, or an ischemic stroke by completely or partially obstructing blood supply to the heart or brain. In the human body, maintaining a delicate balance between clot formation and their subsequent dissolution is vital for a healthy vascular system. Disruptions to this delicate harmony, often caused by factors such as prolonged inflammation, damage to the inner lining of blood vessels, genetic predisposition, or an unbalanced diet, significantly increase the likelihood of unwanted blood clot formation. Adequate dietary intake of specific nutrients can considerably reduce this risk or even prevent the formation of dangerous clots. Below, we will explore in detail how active compounds found in fruits play a central role in regulating the complex mechanism of clot formation in the body. Particular attention will be paid to how powerful antioxidants, abundant in these natural gifts, effectively reduce systemic inflammation, a key factor prompting clot formation, thereby simultaneously lowering the risk of clots and providing comprehensive support for cardiovascular health. Avocado holds a distinguished place among the best fruits that aid in combating blood clots. This naturally endowed fruit is a true treasure trove of antioxidants, with vitamin E playing a key role. Vitamin E is known for its ability to effectively reduce the risk of excessive platelet aggregation, which is a primary step in clot formation. In addition to its high vitamin E content, avocado is also rich in monounsaturated fatty acids, particularly oleic acid. These beneficial fats not only help lower bad cholesterol, LDL, levels, but also actively reduce systemic inflammation in the body, a crucial factor for maintaining cardiovascular health. Chronic inflammation can damage blood vessel walls, creating a fertile ground for the formation of atherosclerotic plaques and subsequent clot development. Furthermore, avocado contains a significant amount of dietary fiber, which plays a fundamental role in blood sugar control. Fiber slows down the digestion and absorption of carbohydrates, preventing sharp fluctuations in glucose levels. Elevated and unstable blood sugar levels can damage the endothelium, the inner lining of blood vessels, and, consequently, contribute to clot formation. Thus, regular avocado consumption can not only strengthen blood vessel walls, but also stabilize metabolic processes, comprehensively reducing the risk of clot formation. Pineapple, an exotic fruit, delights not only with its taste but also with its beneficial impact on the vascular system. It is rich in vitamin C and manganese, two powerful antioxidants that effectively combat free radicals in the body. These unstable molecules cause oxidative stress, damaging cells, including blood vessel walls, which can lead to inflammation and clot formation. Vitamin C, in turn, plays a crucial role in collagen synthesis, a key protein that ensures the strength and elasticity of vascular walls. Healthy and elastic blood vessels are less susceptible to damage and, consequently, less prone to clot formation. However, the true gem of pineapple in the context of thrombosis prevention is bromelain, a complex of digestive enzymes. Bromelain possesses strong anti-inflammatory and fibrinolytic properties, meaning it can break down fibrin, the protein that forms the basis of blood clots. This property helps prevent excessive blood thickening and promotes the dissolution of small clots. Thus, the unique combination of antioxidants, vitamins, and enzymes in pineapple comprehensively improves vascular health, significantly reducing the risk of clot formation. Incorporating pineapple into your diet can be not only a pleasant culinary experience, but also an effective way to maintain heart and vascular health. Kiwi, despite its modest size, is a true treasure trove of antioxidants that actively counteract clot formation and support vascular health. Of particular note is the vitamin K contained in this fruit. Contrary to the common belief that vitamin K always promotes blood clotting, its function is far more complex, involving the delicate regulation of coagulation processes. Vitamin K plays a crucial role in synthesizing proteins involved in both blood coagulation and anticoagulation. Thus, kiwi helps the body maintain the necessary balance. Blood effectively clots to stop bleeding, yet it doesn't form excessive clots that could obstruct vessels and disrupt blood flow. Furthermore, kiwi contains serotonin, a neurotransmitter known for its influence on mood and sleep, as well as folate, child vitamin B9, which plays a key role in homocysteine metabolism. Elevated homocysteine levels in the blood are a risk factor for cardiovascular diseases and clot formation, as homocysteine can damage artery walls. Improved mood and reduced stress levels due to serotonin also indirectly contribute to cardiovascular health, as chronic stress can negatively impact blood pressure and trigger inflammatory processes. Thus, kiwi is a versatile choice for strengthening both physical and psycho-emotional health, collectively reducing the risks associated with clot formation. Pomegranate, a fruit steeped in ancient history and reverence, is a true treasure trove of antioxidants that beneficially impact the cardiovascular system. It effectively helps lower blood pressure, which is an important aspect in preventing heart diseases. The active compounds in pomegranate inhibit the formation of atherosclerotic plaques, thereby reducing the risk of clot formation. Unique compounds like punicalagin and ellagic acid, found in pomegranate, are powerful polyphenols capable of improving endothelial function, the thin layer of cells lining the inner surface of blood vessels. A healthy endothelium plays a crucial role in maintaining normal vascular tone, preventing inflammation and platelet adhesion. Improved endothelial function promotes smoother blood flow and reduces arterial stiffness, significantly decreasing the likelihood of clot formation. Regular consumption of pomegranate juice increases nitric oxide (NO) levels in the blood. Nitric oxide, as a powerful vasodilator, helps relax and widen blood vessels, improving blood flow and preventing the formation of dangerous clots. Its pronounced anti-inflammatory properties make pomegranate an indispensable dietary element for combating atherosclerosis, hypertension, and other chronic vascular diseases, providing comprehensive protection for the cardiovascular system. Grapefruit, a juicy citrus fruit, stands out for its unique qualities, making it a valuable ally in preventing clot formation. The natural salicylic acid found in this fruit has an effect similar to acetyl salicylic acid, widely known as aspirin. It helps reduce blood viscosity, thereby effectively preventing excessive clot formation. Beyond salicylic acid, grapefruit abounds in various flavonoids, with naringenin being particularly noteworthy. These compounds possess pronounced anti-inflammatory properties, protecting blood vessel walls from damage caused by inflammatory processes and oxidative stress, which in turn contributes to improved blood circulation. It is worth emphasizing that grapefruit not only helps thin the blood, but also plays a role in lowering blood cholesterol levels. This effect is achieved due to its high pectin content, a soluble fiber that effectively binds fats and cholesterol in the intestines, promoting their removal from the body before they can be absorbed. Reducing the concentration of low-density lipoproteins, or bad cholesterol, directly lowers the likelihood of atherosclerotic plaque formation, which serves as the basis for clots. Such a comprehensive effect, blood thinning, anti-inflammatory action, and cholesterol reduction, makes grapefruit an excellent choice for those seeking to maintain cardiovascular health naturally. However, it is essential to consider the potential interaction of grapefruit with certain medications, especially those used to lower cholesterol or blood pressure, so consulting a healthcare professional before regular consumption of grapefruit is recommended. Oranges, these vibrant fruits of the sun, are not only a source of invigorating energy, but also a reliable aid in maintaining vascular system health. Flavonoids abundant in these citrus fruits play a paramount role in optimizing blood circulation by promoting vessel dilation and preventing excessive blood thickening, which can trigger clot formation. One of the most well-known flavonoids found in oranges is hesperidin. This compound not only positively impacts the function of the endothelium, the inner lining of blood vessels, but also helps lower elevated blood pressure, a significant risk factor for cardiovascular diseases. The high concentration of vitamin C in oranges is also of exceptional importance. As a powerful antioxidant, vitamin C is essential for collagen synthesis, which, as previously mentioned, strengthens blood vessel walls, increasing their elasticity and resistance to damage. Healthy and strong blood vessels are less susceptible to inflammatory processes and the formation of atherosclerotic plaques, which in turn prevents their blockage and clot formation. Consistent consumption of oranges, both fresh and as natural juice, helps maintain blood vessels in optimal condition, significantly reducing the risk of thrombosis and providing an accessible, natural way to strengthen the cardiovascular system. Berries, from cranberries to blueberries, rightly hold a distinguished place on the list of superfoods due to their unique composition and powerful positive impact on human health. Their high content of polyphenols, including anthocyanins and flavonoids, endows them with pronounced anti-inflammatory properties and helps lower harmful cholesterol levels. This dual action plays a key role in preventing clot formation, as inflammation and elevated cholesterol are major risk factors for atherosclerosis and thrombosis. Furthermore, many berries are rich in natural salicylates, substances that have an effect similar to aspirin, known for its blood-thinning ability. This helps reduce platelet aggregation and maintain optimal blood fluidity, significantly decreasing the likelihood of unwanted clot formation. Regular consumption of various berries not only improves overall circulation, but also effectively reduces oxidative stress in the body, which can damage blood vessel walls. Berries also contribute to reducing arterial stiffness, making them more elastic and functional. All these comprehensive benefits make berries an indispensable component of the diet for those seeking to actively reduce the risk of thrombosis, atherosclerosis, and other serious vascular diseases, thereby ensuring long-term cardiovascular health. Can walking truly prevent blood clot formation? Undoubtedly, yes. Regular walking is one of the most effective and accessible methods to significantly improve blood circulation in the body and efficiently prevent clot formation. Moderate physical activity stimulates muscle contractions, especially in the lower limbs, which promotes the active return of venous blood to the heart, preventing stagnation. In situations of prolonged immobility, such as long flights, car trips, or office work where a person is forced to remain in a static position, the likelihood of developing deep vein thrombosis, DVT, significantly increases. In such circumstances, regular short walks or even simple leg movements in place promote active blood flow to the lower limbs, preventing stagnation and consequently reducing the risk of dangerous clot formation. This low-intensity exercise not only significantly lowers the likelihood of clot-related complications, but also generally supports healthy blood flow in veins, ensuring their elasticity and functionality. When a blood clot forms in the body, the consequences can vary widely, ranging from mild to extremely life-threatening conditions. The severity of the consequences directly depends on the clot's location and its potential to travel. In cases where a clot forms in superficial veins or non-critical areas of the body, localized symptoms are observed. These include swelling, pain, skin redness, or discoloration in the affected area. However, a much more serious threat is posed by clots forming in deep veins or arteries. Equally dangerous is when a portion of a clot breaks off, becoming an embolus that begins to travel through the bloodstream. In such situations, the embolus can reach vital organs like the lungs, heart, or brain, leading to critical, life-threatening conditions. These conditions include pulmonary embolism, which occurs when an artery in the lungs is blocked, myocardial infarction, heart attack, caused by the obstruction of a coronary artery in the heart, and ischemic stroke, developing from the blockage of an artery supplying the brain. Symptoms requiring immediate medical attention include sudden shortness of breath, intense chest pain, unexplained limb weakness, speech difficulties, and sudden disorientation. The appearance of these signs may indicate that a clot has migrated to a dangerous area and requires immediate medical intervention. Can a blood clot disappear on its own? Under certain circumstances, blood clots exhibit a remarkable ability to dissolve on their own, a result of the coordinated action of the body's anticoagulant and fibrinolytic systems. These systems, acting as invisible guardians, continuously maintain a balance between blood clotting and dissolution processes. Typically, spontaneous dissolution is observed in small clots forming in superficial veins, especially in the lower extremities. However, it should be emphasized that large or life-threatening clots, such as those forming in deep veins, e.g., in deep vein thrombosis or arteries rarely disappear without medical intervention. In such situations, immediate medical attention is required. Doctors typically prescribe anticoagulants, medications that not only prevent clot growth and the formation of new clots, but also aid in their gradual dissolution. In some cases, thrombolytic drugs, which actively break down an already formed clot, may be prescribed. Life expectancy with a blood clot, quality of life, and disease outcome are determined by several important factors. These include the clot's location, size, growth rate, the patient's overall health, and coexisting conditions. Small, non-dangerous clots, especially in superficial veins, may not be life-threatening and can be managed. However, large or unstable clots in deep veins or arteries carry the risk of detachment and embolism to vital organs, which can lead to fatality or disability. Timely detection and treatment of thrombosis reduce mortality and the risk of complications. For instance, with a small clot in the leg at an early stage of thrombosis, bed rest or moderate physical activity, as recommended by a doctor, along with fluid intake, can prevent its growth and migration to the lungs. Prevention and control, including adherence to medical prescriptions, medication, e.g. anticoagulants, and lifestyle changes, diet, physical activity, play a crucial role in treating clots, preventing recurrence, and improving patient outcomes. If thrombosis is suspected, it is essential to consult a specialist, as self-treatment can be dangerous. In conclusion, it is important to emphasize that maintaining cardiovascular health and preventing clot formation is a multifaceted process where a balanced diet plays a key role. Integrating the previously discussed fruits, rich in antioxidants, vitamins, minerals, and unique bioactive compounds, into your daily diet is an effective and enjoyable way to strengthen blood vessels, optimize circulation, and reduce the risks associated with clot formation. It is crucial to remember that a healthy lifestyle encompassing a balanced diet and regular physical activity, combined with systematic medical checkups, is the most effective strategy for maintaining longevity and overall well-being. Daily care for your heart and blood vessels will be the cornerstone of robust health for years to come.